Hi, my name is Police Dept. I'm your Emergency Services Director for Talbot County, and I'm here tonight with a couple guests, and we're here to have a community conversation around the coronavirus and how it's affecting us in Talbot County. I'm joined tonight with Dr. Frida Wadley, our health officer, and Dr. Kelly Griffith, our superintendent of Talbot County Schools. And they're both absolutely wonderful people, and they're doing great things. I wanted to just take a minute, Dr. Wadley, and allow you to share with the community your perspective of what we're dealing with and some of the challenges, and maybe, what some of the people should be thinking about.
Okay. I think probably I can understand the fear of the community really well because, Clay, we haven't seen anything like this, okay? Yeah. And I've been in public health quite a few years, and it's new. And new is scary, okay? And plus, we've seen a lot of changes, and we daily get the news reports and closing this or canceling that. So I can understand why people are fearful. What I try to do is to get them to put it in perspective. It's not that this virus is not serious to our health. We have to take it serious, but let's put it in perspective. We're still seeing that the ones most terribly affected are the older ones, 60 and above. And so we take very seriously when we say stay away from crowds and stay away from sick people, because that's the ones we're most concerned about with this virus. It doesn't really affect the children like flu. Flu's a lot worse on children. So it's the elderly that we're really thinking about. And then secondly, when we say things like, your hand sanitizer and washing your hands and all of that, history has shown that that is a very effective way to limit the spread of infectious diseases like this. So I like to ask people just to put it in perspective about what the flu does to us each season and what this virus is doing across the globe, and to remind people that 20,000 people have already died in the U.S. alone this year with influenza. And I can just pretty much promise you nothing close to that will happen with this virus. But when we hear all this stuff about why is it closing if we've never seen anything this bad, for the first time we've got enough information from the other countries to know sort of how it's spread. So the whole thought is, if we really do the social distancing, if we stay as apart and don't spread it rapidly, we'll push that peak of that you see that sort of overwhelmed the hospitals and the health system in those other countries. You're trying to push that down so that you at least don't have that problem. Mm-hmm. And so that's the reason you haven't seen these measures taken, and it's hoped that that will really help all of us in getting over this next 2 or 3 months as well as possible.
Exactly. Thank you, Dr. Wiley. Thank you very much. And from an emergency services perspective, I just want to take just a minute and talk about the system we have in the United States to manage crisis, and that's been implemented. And we've seen in Maryland, our governor leaned forward and has a very clear strategy for the state of Maryland. In every jurisdiction, there's an emergency manager. And we reach into our community and identify stakeholders to begin working issues. And that's part of what we're doing here. We're creating a community conversation because we have two overarching goals that we want to do, all working together. Number one, we have to all clearly understand what is going on all the time so that we can work these issues, right? And be successful. That's number one. And number two, we have to be successful at having a transparent, clear, comprehensive message to our community, not only outward, but to hear back from them. So it's part of a system. The difference in this from a hurricane or a snowstorm, this is not going away anytime real soon. And so we're in for the long haul, and that really drives the importance of working with our community so that they become patient and they become kind to each other, they remain kind to each other, and just, working through it. And we're going to do it by working together and communicating. So that's a little bit of what we're doing in the emergency management field to pull everybody together like Dr. Wadley and Dr. Griffith. So I want to turn for a minute to Dr. Griffith because she's just a superhero. She loves her kids in Talbot County Public School, and she has a great team, and she has really led in an area that we are working an issue. When the governor actually closed senior facilities and schools. It really drove an issue that we had to address. Can you take a minute and talk a little bit about that, Kelly?
Sure, I'd be happy to.
Thank you.
So first of all, schools are closed through next Friday, and that is March 27th, and that is the directive that we have received to clean our schools and sanitize our schools and our school buses. So that is what we're working on now. As you know, we don't know the what ifs, and we don't know if this will be extended. We do, at this time, all of the Maryland superintendents are having a conference call with the state superintendent every other day at 2 o'clock. So we are getting timely information. I'm also on several conference calls with you all every single day. But we do know that we needed to meet those immediate needs. And the immediate needs, first of all, was food. And so what we've done is we have worked with Sodexo, our food service, and we started out with a couple initial sites because we were told it was restricted to just a site in Easton and a site in St. Michael's because those are our summer meal sites. Since that time, they have lifted the restrictions and we can actually set up shop in a lot of different areas and a lot of different sites. So that's really good news for our community. But that doesn't happen that quickly. We have to make sure we have the food. We have to make sure we have the volunteers. So there are a couple ways that you can help as a community. First of all, we do have a community sign-up sheet. You can email Emily Moody at emoody@talbotschools.org. She has a sign-up genius sheet. You can get on there. It's also on Facebook. And sign up to volunteer. We have over 200 volunteers now. And we are extending our sites. Our sites are open from 9 to 11. So right now, tomorrow we will stay with the 4 that we have. We have Easton Elementary, Easton Middle School, St. Michael's Middle High, and the St. Michael's Police Department. On Thursday, we will extend and add the following sites. We will add the Neighborhood Center. We will add Chapel District Elementary, White Marsh Elementary, Tilghman Elementary, and also the corner of Aurora and Dover Street, right near the Chesapeake Multicultural Center. And we will also deliver, if people need meals delivered, to a neighborhood drop-off area or if someone is in need in a remote area. And we are going to do that on a case-by-case basis. We are also beefing up. We were doing 2 meals. Now we will be doing 3 meals and a snack to deliver. And then on Fridays, we are also coordinating with Care Packs. I'd like to really thank Emily Moody and Megan Cook, who spearhead the Care Packs, and Maggie Gow. And we will all send children home with Care Packs on Friday. So those are their meals over the weekend. So that way they'll have their meals 3 meals a day, 7 days a week.
That's exciting. And taking care of your children to make sure that they can eat.
Right.
And that's prime. But you're doing more than that. You're reaching out with the senior center and you're addressing other vulnerable populations. Can you talk just a little bit about that as well?
Well, we are. I mean, we're really trying to also help any of our community partners. Just today, we had a couple folks said they ran out of hand sanitizer. And our schools are empty of children, but we have lots of hand sanitizer. So we delivered that quickly. And we are able to mobilize our volunteers to help them as well. And I think that's really important. And I do want to say one thing, because I would be remiss if I did not. When the children left school last Friday, they left with quite a bit of work to work on. So I'm hoping they're taking advantage of this time, even though it was beautiful outside today, to continue their learning. So
that's excellent. Mm-hmm. Well, there's good things going on, and so we are working issues. We're working sheltering issues. Yes. We're working mass feeding issues. We're working messaging issues, and we're going to continue to face issues. But we as a community can certainly come together, and we have just such wonderful people.
We do.
And I think what I'd like to say in wrapping this up is that, we know that this is going to be a prolonged situation, but I really give kudos to our private sector, our business community, our nonprofits, because they're just so innovative. They've jumped right in, and restaurants have just turned from dining to being able to supply carry-out foods, and you're coming up with creative ways. Mm-hmm. So we will continue to work hard with our community to get through this. It's going to be a long haul, and we will continue to have these little forums if the crowd out there says we're doing a good job. So I'm just going to open it up for any last comments from Dr. Wadley or Kelly.
No, just stay positive, keep our kids calm. We'll get through this. We have such an amazing community, and we're coming together, and we will prevail.
Right, and if any older citizens out there, we have several that we take up care of in the health department, and if they need anything, we urge them to call the health department.
Great. Well, thank you both, and
Absolutely.
To you out there, be kind to each other, keep
Yes.
your ears open, and lend a helping hand wherever you can. Thank you very much.